A new study is predicting great news in the battle against cancer. Over the next 20 years, death rates are expected to plummet. But as Patty Kirkpatrick tells us, if you really want to survive cancer, your best chance is taking the fight into your own hands.
But they also came up with a figure suggesting, anyway, that by the year 2030, we may see a reduction in cancer death rates by about 17%.
Dr. Robert Wascher from Cancer Treatment Centers of America is talking about a British study predicting a dramatic drop in death rates from many cancers. For instance, a 43% drop for ovarian cancer, 30% for breast cancer, and 9% for lung cancer. Wascher says those predictions are based on advances over the last several decades, including better screenings, especially mammograms, pap smears, colorectal, and prostate exams.
We know those screening tests for those particular cancers do effectively reduce the risk of dying of those cancers.
And that has combined with new advances in targeted therapies.
Now we're not just talking about treating breast cancer in general, but we're talking about treating this patient's breast cancer with this particular genetic abnormality or that abnormality.
Radiation treatments are more accurately targeted now as well, which Wascher says has added up to more lives saved.
If you look at all patients with cancer, about 67% or two-thirds of them will be alive and free of cancer 5 years later.
But here's the bad news. Wascher says we may be sabotaging our own success.
30, 40, maybe 50% of all cancer cases are associated with modifiable, changeable lifestyle and diet factors.
Tobacco use remains the #1 cause of preventable cancer and cancer deaths, but it's far from the only cause. 10% of all cancers are linked to obesity, a growing problem in this country.
And you can develop cirrhosis or scarring of your liver and liver cancer just from being very overweight or very obese.
In his book on preventing cancer, Dr. Wascher says physical inactivity, a diet high in animal products, and alcohol could all push death rates higher.
Alcohol is an underappreciated carcinogen linked to cancer of the breast, linked to esophageal cancer, pancreatic cancer, stomach cancer, colorectal cancer, liver cancer.
Bottom line, he says if you really want to survive cancer, take the battle into your own hands.
An ounce of cancer prevention is worth a ton of cure.
And with those lifestyle changes, the doctor says you can decrease your risk of death by 50%.